So we've had multiple patients improve. This is one example of my friend. Stress test was good. His coronary calcium score was 58. That's a CAT scan score. He had elevated mercury and lead. His cholesterol was 245. His CRP, which is an indicator of inflammation, was elevated at 3.5. He underwent 40 IV chelations, plus the rest of the stuff from the High Five program. And 8 months later, his coronary calcium score was 0. So this is one of my favorite quotes from Thomas Edison back in 1902. That's the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. So remember, high five. So here, exercise and rest is another thing. Most people know about the exercise, even though they don't do it, but at least they're aware of it. But hardly anyone ever thinks about rest, and rest is also almost as important. What to eat? Back in 1996, I did the original research for South Beach Diet, the first 40 patients. South Beach Diet worked. It's a low-carb, Atkins-like diet. It definitely works for a little while. It's just hard to maintain that type of diet. You really don't want to restrict any one certain food. So sort of the best way to eat is what's called conscious eating, where you sort of become aware of what it is your body needs, and you actually sort of give it that, because it changes from day to day. So again, sort of a few eating points that people don't know. Get as much organic as you can. The best is to grow your own, of course. It's a little hard here in Miami. And no microwaves. Microwaves change the structure of food, so it's not really as recognizable to us. Distilled water is the most lead-free water you can get. So sort of the main points. The head. Ultimately, it's all in our minds. So you definitely want to have laughter, enlightenment, love. So that's right on my trip to India, trip to Washington. That's a contrast. Again, so the results from some of the different studies, cholesterol-lowering drugs do lower risk 10 to 30%, on average 24%. Nutritional changes, 50 to 70%, exercise 100 to 200, exercise plus diet 150, sort of what we do with all the hormones and toxins 205, all the way up to if you do hormones, toxins, exercise, and diet, you get a 405% risk reduction. So every little piece you do is more significant than each piece you do. So again, here's our study that we presented to the American Heart Association. You can see using Chelex from Zymogen, which is EDTA and DMSA, for patients who had mercury and lead. Following 6 months treatment, we had 57% improvement in lead levels, 55% improvement in mercury levels, 18% in total cholesterol, 14% in triglycerides, 6% HDL, and 25% LDL. So how do we look at you? So we like to do a stress test that gets rid of the risk of any sudden events occurring in the next year. Here's a little joke where we had a mom in with her kids and everything. We do the left one. I was saying the CT scanner, you can actually see the coronary arteries like that on the right. See if you have any blockages starting without doing an angiogram. We use ultrasound, which has no radiation. We do the blood test, again looking for mercury, lead, toxins, thyroids. We do a few extra tests that sort of normal Western traditional doesn't do. We like to do a saliva hormone testing. Your hormones actually work on the cellular level. So saliva gives you a clue into that. Plus you can check 4 levels during the day, especially for cortisol. That's very important. Like I said, we check the toxins. A lot of people have hidden food sensitivities, not a true allergy, but where you'll eat something, you'll feel sort of reflux or maybe a rash 3 days later, and it could be hidden food sensitivity. Just myself, I had a weird rash under my left eye for about 2 years. No one could figure it out. Mayo Clinic, Cleveland Clinic, Harvard, and it actually turned out to be a broccoli intolerance. Intracellular vitamin levels. A lot of people like to tell me, oh, how do I know I'm taking all these vitamins? Do I need them? Do they help? You can actually measure that. You can see exactly which level of vitamin you have or you need. neurotransmitters. After you're sort of detoxified, your hormones are in balance, the next thing is sort of try and balance the neurochemistry of your brain. So there's amino acids you can take for that. Especially give depression, anxiety, and to get people off of things like Prozac and Zoloft. So this is another little joke. The first dietary advice ever given was God to Adam and Eve, and it was don't eat the apple. They slipped. So I just sort of think of, these people have been on Earth and some of the things they've been able to accomplish, supposedly attainable by us. So what's ahead? When I did this 2 years ago, a lot of these things we hadn't done. So we did shoot a TV pilot. It's at globalcharitymedia.com if anyone wants to see it, sort of presenting some of the holistic practitioners here in South Florida. My book is almost done. I was missing the thyroid part. We're, of course, still in private practice here. We did found the Well for Health charity in Santa Fe, New Mexico. And at that time, I was thinking about starting this holistic healing center there, which now we've had open for 2 years. So let me show you what that looks like. So this is actually, it in Santa Fe. That's the front. We have on the top right, you can see we have 2 organic gardens and a greenhouse and a stable that has 16 chickens. So we get basically all our own vegetables, all our own fruits except oranges, and all our own eggs. So that's sort of phase 1. Phase 2, we'll be having fish tanks to raise our own fish and putting in solar and solar and wind. So basically it'll be a fully self-sustained sort of place. That's what my office looks like over there. And the other thing I'm working on then is the mobile RV. On the right you can see what it looks like on the outside. It's a fully functional clinic. The concept is sort of twofold. One is when you go to the doctor nowadays, he sees you or I see you. We order tests, you do the test, then I see you back. It sort of takes a couple weeks. With this, we'll be able to, the technology is there already that we can do everything in about 3 hours. There's blood tests that in 10 minutes you can have all the results. We have a mobile treadmill, a mobile ultrasound, and we can also come to your house. If you look at what people are eating, it's often, making a few mistakes. Like, please, no. Here on the bottom is my car. It's a Honda Ridgeline. We installed 16 batteries in it. It can go 60 miles fully electric before it switches back to hybrid. So that was sort of cool. And like I said, we'll put in solar and wind to do the next little. In 2 years when I present again, I'll show you. Rest of it. Sort of just to let you sort of expand your mind. Sometimes people come to me, they're 60 years old now. Oh, I'm so old, I'm so tired. Just to sort of think of things a little differently. Number one, so in the middle there is my oldest patient. He's 97 years old. When he comes to my office, I tell him to stay away from doctors. In the middle on the lower is Gracie Jiu-Jitsu. He actually just happened to die last year, but he was 95 years old. He's the one who came up with the UFC concept. At age 95, he was still traveling by himself, cooking on his own, giving lectures worldwide, and would still fight in the middle of a class. Somebody would ask something, and he'd do this little thing on him, 95. And on the right, on my trip to India, we met this gentleman who runs that little temple there. He was 120 years old. So just, sort of don't think old. Okay. The other sort of breakthrough my friend's working on in France at the Pasteur Clinic is that your DNA isn't your destiny. There was always an idea of, oh, my mom had heart disease, my granddad had heart disease, I'm going to get heart disease. It's absolutely not true. You are predisposed to that, but what you do is turns on and turns off your DNA stronger than what your DNA actually says. So that's like a good idea. Unfortunately, you can't blame it on the genes anymore. Now it's actually your fault. So again, train your mind, change your brain.